Medical professionals in Brandon have sounded the alarm, describing their ER as unsafe and unsustainable, with a 34% vacancy rate among emergency physicians that will rise to 42% in January. In a letter sent to the Minister of Health, which I'll table, they state, quote, "We are frankly on the brink of collapse," and, quote, "We are witnessing levels of burnout and exhaustion that we have never witnessed previously." Wow. They end the letter with, quote, "In our current conditions, we will experience a catastrophic outcome that could have been prevented. The Grace and Brandon hospitals need help now. What is the Premier doing today to address the immediate crisis in our emergency rooms?"
Right on.
And for a government that touts itself as a listening government, to not immediately respond to a letter that's this distressing from a group of frontline healthcare professionals, I think is very telling. And it's reflected in comments we've seen made publicly by nurses, by MAHCP, that healthcare workers don't feel heard by the government, despite their claims to the contrary. One of the solutions to the crisis in the ER proposed by the NDP was the construction of minor injury clinics, and they've opened one in Brandon. And this was touted as a solution to ease pressure on the ER. The Premier boasted that it would function as an urgent care centre. And when I met with these healthcare professionals earlier this week, they told me it's not functioning anywhere near the level of an urgent care centre. And it's in fact not relieving pressure on the ER because it lacks diagnostic tools. It's not taking walk-in patients. You have to make an appointment, and it's not fully staffed. For the month of December, they told me that they've only got staff for 6 out of 31 days. So that is not what was advertised, and that's not going to be an effective solution to ER pressure. You know, we still haven't seen, and there was no mention of it in the throne speech yesterday, a really credible plan to recruit and retain and train staff in Manitoba. And in addition to the staffing piece, one of the issues that was raised with me when I met with these healthcare professionals earlier this week was the acuity level of patients that they're seeing has really intensified in recent years, and they're seeing a lot of drug-induced psychosis, a lot of drug issues, and that goes back to the NDP failing to address the addictions crisis, failing to address the mental health crisis, and failing to give healthcare professionals the resources they need to deal with these cases when they come through the ER.